we need to develop a relationship with our body. We need to know what our baseline is. And how do we understand what our baseline is best? Is by challenging our body, by performing physical exercise, and then we know where we stand.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hello, everyone. I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're breaking down the everyday choices that make a difference for your heart. From food and fitness to hidden risk factors, you'll learn simple steps to protect yourself starting right now. And we're joined by Dr. Sergiu Darabant, cardiologist with Baptist Health Heart and Vascular Care. Thank you so much for being here.
Hi, thank you so much for having me. It's really a true honor and my pleasure to be here in your studio today.
Well, and so exciting for the audience because really these are the most searched questions. So let's get right to it. Heart problems and heart disease is still the number one cause of death in the United States. What do you think can be done to lower those morbidity rates?
You know, that's a great question. Cardiovascular disease is very proeminent. We have, when it comes to the heart, valvular heart disease, coronary artery disease, heart rhythm disorders. There are so many issues that can occur and affect somebody's heart health. So in order to prevent these issues from occurring, it would be fantastic to raise awareness for the general population, to better inform them on how they can protect their heart health and take steps towards that goal themselves.
When we talk about those steps, say someone that hasn't been to a doctor in a long time, what are the first steps that they can take to take action right now? Screenings, what are the different options that they have?
I think the first step when wondering about one's heart health is to actually pose that question directly. Is my heart healthy? Am I a healthy person? And it's important to do a self-analysis. And when we do that, we realize that we have some questions about our own body, and we want to have those questions answered. We do that by seeing a professional, whether it's a primary care provider or a preventive cardiologist like myself.
And how can they do that through Baptist, a prevention screening program? How can they schedule an appointment or take action on that end?
PCPs are always available as part of the Baptist Health team to start the process. We have a wonderful group of primary care providers that identify risk factors, and then oftentimes they can refer our patients to further seek medical care and advice. If they would like to see us directly, our cardiovascular team is always available to offer that advice directly by even bypassing that original network.
Okay, so let's get into the fun stuff because we've heard a lot about the Mediterranean diet, about the DASH diet. And the reason why I say fun is because I think people like to think that they can, eat their way to a healthy heart. Why is it that these particular diets are better, say, or have gotten good press lately?
These diets are really fantastic. Very much so for the nutrition that they're offering our patients, but more so, it encourages everybody to stay away from processed foods. So yes, the Mediterranean diet, the DASH diet, those are very healthy diets because in general, those diets are comprised of whole nutritious foods while emphasizing avoiding processed foods. And processed foods are the foods that we want to stay away from.
Now, for people wanting to adopt that kind of lifestyle, is it okay if they jump right in, or do you suggest that maybe they go slowly? How do they begin?
Certainly, although adoption can be difficult, we're all pretty much set in our ways. And oftentimes I have patients asking me, tell me a little bit about what I should be eating. And then that requires a true deep dive in what they like. So that's a long conversation. But if somebody wanted to do it all of a sudden and change their diet drastically, they could. However, it is harder. It is important to just gradually start avoiding those bad foods and deviate more towards whole foods, which are much better for you.
And as you said, it is a deep dive. So I recently had a friend say, you know what, I don't buy bread at home. So she'll eat bread out of the home. And I started adopting that. And you know what? I really feel that it works because I'm eating less bread. So maybe just a little tip like that, just starting with that can help. But the Mediterranean diet is delicious. So you won't feel like you're missing anything. That's for certain.
That's a great tip. Everybody should follow that. The less...
don't buy it at home.
The less unhealthy foods we have in our home, the less likely it is for us to consume them.
Okay, speaking of which, wine and chocolate, are they good for the heart?
Delicious, right?
So good.
Well,
I thought I'd get you on
well,
this.
it's very much debated. And very much debated. I like chocolate and a little bit of red wine, just like anybody else. However, we have to stress that it has to be consumed in moderation. There is some observational data suggesting that dark chocolate and potentially very low doses of red wine could promote cardiovascular health. However, the data is not as robust as we would want it to, that I could start prescribing chocolate and red wine to all my patients and tell them they're going to be healthy just by doing that.
But we do hear a lot about that in the press, that it is good for your heart. Why do you think that these reports are out there?
I suppose we're always looking for the better alternative. Dark chocolate is less calorie dense and has less sugar. Therefore, it's preferred to milk chocolate. A little bit of red wine, which is to say 5 ounces 2 to 3 times a week, has been studied to see if it promotes heart health, although, as I mentioned, the data is not very robust. It satisfies perhaps a craving for alcohol, but it's not really recommended just for your cardiovascular health.
Sure, and that's when we come into cultural issues, and I guess that's why we're so desperately trying to seek permission for some of these habits that we enjoy. When we speak about cholesterol, high blood pressure, prediabetes, these are all conditions that many people have, and maybe they don't even know that they have it. So how common is it for someone to be at risk yet look healthy on the outside?
It could be quite common. Now, we all understand our general habits. If we feel like we're generally sedentary, as I mentioned before, we do a deep dive and take a look at ourselves and wonder, are we eating the right foods? Are we staying healthy? Are we exercising regularly? We get a clearer sense of our overall general health. And although we may have a normal body habitus, it is important to follow up with a general practitioner to do some basic screening tests and figure out where your health levels are truly.
And when we talk about exercise is so incredibly important. Mobility, not being sedentary. Really, it's not being sedentary, because you need the blood to flow. Let's talk about how important exercise is, and that it doesn't have to be necessarily running a marathon, but a consistent, regular exercise routine. Why is it so important to move that blood?
Well, certainly we say use it or lose it, and it is important to get active. Now, the American Heart Association recommends 30 minutes of moderate intensity activity 5 times weekly for optimal cardiovascular health. And then just getting out there, being active, doing some activities that you generally enjoy doing. It could be swimming, it could be walking, whatever that may be, it helps promote cardiovascular health.
It's just staying active, is moving and not sitting on the couch, because really I've had the experience, and it's deadly. It's truly not good for your health. Many people say, if I don't have chest pain, my heart is just fine. What do you say to that?
Just in our introduction today, I had mentioned that there's so many cardiovascular conditions. Chest pain relates to blockages in the coronary arteries. When the oxygen to the heart muscle is cut off, that's what provokes chest pain. However, there may be other cardiovascular conditions that need to be unraveled through regular investigations. And chest pain is not one of the classical symptoms for those.
And then it's different for men and women.
Different for men and women, indeed. Many women can have microvascular disease, which is to say that they have their coronaries obtruded. However, they're smaller coronaries, not the large coronaries, as you would expect in large heart attacks or significant cardiovascular issues, I should say. Therefore, they may have atypical symptoms like jaw pain, generalized fatigue, some burning sensation in their chest, or maybe they have heat intolerance.
And these are all symptoms that they might not recognize. It can be easy to shrug off things like being tired, feeling fatigue. When do we know when it's a symptom, or when it's just when it's a red flag, when it's a high risk, or when it's just, yeah, I'm tired?
My best advice that I can give my patients, and I typically do, is we need to develop a relationship with our body. We need to know what our baseline is. And how do we understand what our baseline is best? Is by challenging our body, by performing physical exercise, and then we know where we stand. I'll give you a quick example. If for 5 years we don't do anything at all, and all of a sudden we decide to be very active very quickly, we might start feeling very short of breath. Now, that could be because of deconditioning, because we just haven't conditioned our body, or that could be because of heart disease. A cardiologist can help you differentiate between those and perhaps offer a few tests to better understand your physiology. But it's hard to know. So then, if you stay active all of your life, you're always in a constant relationship with your body, and you understand those different variations that might trigger a warning sign.
I briefly mentioned men and women and the difference, but how do these symptoms present differently in a man than a woman? Because from the reading that I've done, it can be very different. And what we know, the literature that's out there, can be confusing, especially for women. So how can you help us understand what are the problematic symptoms for each sex, each gender?
Well, the classic symptoms still remain the same. However, women, as I had mentioned, even though without necessarily having severe cardiovascular issues, they may experience symptoms differently. And those warning signs can be different from what men would experience. And as I had mentioned, just jaw pain, burning in the chest, or a generalized feeling of fatigue that is not clearly identified as to what causes it.
How about if it runs in the family? So in many families, there are many members that have heart issues. When a person is from one of those families, does it mean that that's their destiny? Or do you think that adopting lifestyle changes can help them prevent heart disease?
Certainly, sometimes we can't change the card that we're dealt, but we have so many options to better ourselves and reduce our risk for cardiovascular disease. First-degree relatives, if they've had cardiovascular issues, it is important to pay attention to that. If a male in your family under the age of 55 or a woman in your family under the age of 65, that's a first-degree relative, has had heart attacks, strokes, that's something to pay attention to. Those are the types of scenarios where I help my younger patients identify their risk factors and determine what we can better do to reduce the risk.
We talked briefly about exercise. I was relating it to my own experience, but there's a lot of talk lately about training in zone 2. What is zone 2 exactly, and how does that help us track if we have a healthy heart?
So that's a good question. We focus on increasing our cardiovascular capacity. For example, when we do a cardiovascular stress test to challenge the heart to see if there's any blockages that could obstruct the artery and prevent blood flow to the heart muscle, we want a patient to reach 85% of their predicted heart rate. And we calculate maximum predicted heart rate by subtracting each individual's age from 220. And that's the heart rate where they reach maximum tolerance. That's a pretty high heart rate for most. If you can imagine, the more elderly you are, you get to lower that threshold. So we encourage our patients to exercise to a higher level of cardiovascular tolerance because that promotes vasodilation. It lowers it lowers blood pressure. It improves their cardiovascular health and stamina overall. So zone 2 would be somewhere around 50 to 60% of your maximum predicted heart rate, versus zone 3, higher up than that, maybe 60 to 70%. And then we get into the zone 4 and 5 where we're doing cardiovascular stress testing on our patients.
Right. I have had times where I've done cardiovascular exercise and it feels like my heart, and I'm experienced because I've always exercised, but when I leave it for a while and I come back, it does feel scary, let's say. So a zone 2 is a more tolerable rate, is what you're saying, so that people can maintain it and keep it as a lifestyle. Is that why we look for zone 2?
Yes. Walking at a fast pace may be at zone 1. And then if we go into a jog, we might reach zone 2 and reach that 50 to 60% of maximum predicted heart rate. And at that point, your heart's working harder, your body's working harder, you're challenging yourself to break a sweat, to change your stamina and improve your hemodynamics.
Okay, I like it. Can you share any personal experience as a doctor with preventative care and how it proved to be successful for the patient?
With preventative care, I'm very excited that more young patients are coming to see us. Miami is also a wonderful city, very health-oriented, so we're lucky that that's a mindset here. People are more aware of what their goals are. They're more aware of their diet, more aware of their challenges, their cardiovascular risk, their family risk. and they come to talk to us about it. And that is wonderful. I wish more young patients essentially would do that and be more inquisitive about what they can do better to better their own health.
Because it's never too early, is it, to start working on our health on any aspect, but especially our heart?
Certainly, it's never too early to just be aware of your own body. And I always mention to my patients, it's a marathon, not a sprint. We have to be forward thinking, and we are our best investment. We have to invest in ourselves early so that we can reach for longevity.
I love that advice. Do you find that more and more younger people are searching out how to stay healthy?
Yes, I have patients as young as 18 years old.
Wow.
Coming to see me. Now, of course, at that age, they're very lucky that nothing typically pops up at that age.
If someone is listening to this podcast right now and they decide that they want to do something, what is something that they can implement in their life right now that would make a difference for their heart?
Think of yourself and what your trends are on a daily basis, and pick one thing that you think might make you unhealthy and change it. Make slow changes and be consistent. That's the best thing that you can do. It's not about crash diets. It's not about massive changes overnight. It's about consistency. I've seen some wonderful, healthy patients reach an age that is envied by most, I would say, that have been consistent their entire life. And that is what makes the difference.
Well, I like that because I've always taken care of my health. It's something that's very important to me, which is why I love this conversation. It's been wonderful. Thank you so much, Dr. Darabant. It's been a pleasure speaking with you today. And thank you so much for sharing your insight with our audience. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.